Welcome to Learn from the Case. Hello, how are you? I opened this channel to present some cases. I work within neurology and internal medicine, and I want to share a little of what I have and am learning. I want to comment that I work in different hospitals in different countries. I also train in different countries, so that treatments in different administrations can and will vary. It seems to me that this also helps us, contributes to our medical training. Today I'm going to talk about multiple sclerosis is the most common progressive among white people of Northern European descent. The further from the equator you live, the more risk for developing of this ailment. There are some things that have been linked to an increased risk of developing. Lifestyle, environmental factors can affect the risk of multiple sclerosis. For instance, deficiency of vitamin D status due to little exposure to sunlight, infection with Epstein-Barr virus, we come back to this later, cigarette smoking, overweight. As you probably know, symptoms of multiple sclerosis vary from person to person and depend on the location and severity of nerve fiber damage. These often include vision problems, tiredness, trouble walking and keeping balance, and numbness or weakness in the arms and legs, or hand and feet. Symptoms can come and go or last for a long time. It affects about 250,000 to 400,000 Americans, according to different data. It is characterized by the appearance of patches of demyelination in the white matter of the central nervous system, generally starting in the optic nerve, spinal cord, or cerebellum. And where is multiple sclerosis most common? Canada, Northern United States, most Northern Europe, Southeastern Australia, and New Zealand, according to data from February 2022. In Sweden, there are approximately an incidence of 10 persons per 100,000 persons per year. It is mainly people aged between 20 and 45 who fall ill, and women are affected twice as often as men by the disease. The cause is thought to be partly hereditary, due to the fact that 20% of all multiple sclerosis patients have a close relative with multiple sclerosis. About Epstein-Barr virus again, can Epstein-Barr virus trigger multiple sclerosis? Since a while, is a number of studies that suggest that seropositivity against Epstein-Barr virus or acquisition of the Epstein-Barr virus in adolescents is a major risk factor for the development of multiple sclerosis by transformation of lymphocytes through molecular mimicry. In May 2023, research at Karolinska Institute in Stockholm have found further evidence for how the Epstein-Barr virus can trigger multiple sclerosis or drive the development of the disease. A study published in Science Advances shows that some individuals have antibodies against the virus that mistakenly attack a protein in the brain and spinal cord. And if you see there in the picture shown, there are a number of diseases associated with Epstein-Barr virus. With multiple sclerosis happens that raising the temperature shortens the duration of the action potential of nerves. Some of the early signs of multiple sclerosis is that the symptoms and signs may worsen by heating, for example, with a hot bath or sitting in a sauna, and can be improved by cooling, one of many benefits of cold water therapy. As said before, there is not clear what caused the ailment, but autoimmunity, infections, and heredity, together or alone, may play a role. A breach in the integrity of the blood-brain barrier in a person with hereditance for this may predispose the disease, according to one theory. I hope this video has caught your attention. This presentation is entertainment for students and health professionals who want to listen to studies, discussions, or clinical cases. It is not intent in any way to replace the learning provided by reading medical literature or the experience provided by clinical practice.